I had cancer myself 9 years ago, and I lost two of my sisters last year. And both of them had cancer, but a different type of cancer. So I just thought maybe there was a gene or something that, would foretell my daughters, and I have another sister yet.
As a result of her Sanford chip test, she was found to carry a condition called Li-Fraumeni syndrome. And when you look back at her personal and family history, it starts to all make sense that there is some genetic condition called Li-Fraumeni that's causing the cancer risk in that family.
Went onto the Sanford website and contacted them to have the test. And then I had to wait for them to call me back and schedule. And then it was as simple as going to the lab at my clinic, having blood drawn, and leaving for the day. It's just a very simple test.
The reason for doing that, because this condition leads to, in some cases, up to 100% risk for cancer. What we can do for those patients is actually offer surveillance and screening to help identify a cancer earlier than if we didn't have this information. So it's a really powerful piece of information to be able to use to help better care for our patients.
Peace of mind. When I get my results back from, say, my full body MRI and everything is fine, and later I'll be doing a breast MRI, so they're keeping tabs on that. So I'm really lucky that I've got somebody watching out for me, so that if I get cancer in the early stages, I'm ahead of someone else that has to wait until they're stage 3 or 4.
When you're identified to have a genetic predisposition for a cancer syndrome, for example, there are many instances where we can say, okay, we know this. This is powerful information. Yes, it's scary. It is very scary to know, oh my gosh, I have a genetic change in my body that's gonna cause me to have cancer at a pretty high percentage.
It is totally worth it. And the doctors are wonderful. They're very knowledgeable. And Dr. Hajek here has been very cooperative with my nephew's wife in, visiting back and forth with her as well. So, it's a family thing. Once you've had cancer, there's always that fear it may not come back in the same place. And so having these tests really make me feel more comfortable, because a lot of times the cancer that appears is not the start of the cancer. It may start in another area of the body.
It just really provides a lot of power to not only the patient for knowing their risk, but also the healthcare system for being able to manage that risk.
If there is just a hint of cancer in your family, whether it's a mother or father, whether it's breast, and they've survived it, even so, $49 is a pretty cheap way to find out if you're carrying any type of a gene that could produce cancer. It was all worth it just because my nephew got rid of his thyroid cancer before it ballooned.